Alright, I'm Akila Jackson, and now I will be performing a residual and gravity tube feeding. So the first thing I will do, of course, check my patient's chart, look for any orders, perform hand hygiene, enter their room, provide privacy, adequate lighting, introduce myself, and verify who my patient is, prepare with their ID, and explain to the patient I will be doing a tube feeding for them. I would have to check the residual first to make sure that tube feeding is appropriate. So the first thing I'm going to do is get my piston syringe so I can check the residual. I have a graduated cylinder at the bedside so that way I can suction out, manually suction any gastric content, and I will expel that content into the graduated cylinder. So for my patient, I'm going to pull back all the way to 60 mLs and go ahead and expel the content into the graduated cylinder. And I'm doing this 4 times plus another 10 mLs. So that's 250 mLs total. And according to SJVC Hospital, we can go ahead and perform a gravity tube feeding as long as the residual is less than 300 mLs. So what I will do next is I'm going to take the gastric content from the graduated cylinder and want to flush it back into the NG tube because the patient will need those gastric enzymes to digest their tube feeding. So once the whole 250 mLs are inserted back into the NG tube, I will go ahead and of course the patient is not on suctioning anymore, so the patient was disconnected from suctioning. So now I can connect the tube feeding to the patient. I'm going to make sure I have the tube feeding bag, I have it closed off, so that way once I pour, I'm going to pour my tube feeding into the bag, so that way it doesn't flow out. And then now once I have the full amount of feeding in the bag, I will hang it up on an IV pole and I will allow the feeding to flow through the tube. Alright, once that is complete, I will disconnect the feeding. I will of course close off the tube just in case there's some leakage, but I will disconnect the feeding. I will go ahead and make sure the patient's NG tube is secure and they have the full range of motion of their neck. I will of course assess their skin, make sure there's no irritation. I can also add some skin protectant prior to applying tape and taping up the NG tube. I will note how the patient tolerated the feeding as well. And the patient will not be connected back to suctioning, so there's no need to connect that back. So I'll make sure to cap the end of the NG tube. Afterwards, I'll document my findings, make sure the patient is in a comfortable position, note for pain, make sure the patient's belongings are in reach, make sure the bed is at a low level and the bed alarm is on, and perform hand hygiene upon exiting. That's it.